Welcome to a new deep dive where we take a stack of sources and really try to extract the essential knowledge to get you up to speed.
That's the goal.
Today, we're taking a breath, you could say, and diving into pulmonology, the medical specialty focused on our respiratory system, lungs, breathing, all that.
And all the conditions that can affect it, right?
Exactly. Our sources include Wikipedia pages on pulmonology and respiratory disease, plus an article called Pulmonology, Lungs, and Respiratory Health.
Pretty standard stuff for these dives.
Yep. And our mission is basically to give you a clear, engaging understanding of what pulmonology is all about. Common diseases, diagnosis, treatment.
And maybe even a little surprising history in there, too.
Right. Okay, let's unpack this then. What exactly is pulmonology?
Well, at its core, pulmonology, and sometimes you hear pneumology, respirology, respiratory medicine, even chest medicine.
Okay, lots of names.
Yeah, but they all point to the same thing. The medical specialty focused on diseases of the respiratory tract.
Yeah.
And it's interesting, the names come from Latin, pulmo for lung, and Greek, like logia for study of, and pneumon, also lung.
So lung study, basically. Makes sense.
Pretty much. It's all about that system that lets us breathe.
And our sources mention it's a branch of internal medicine,
Right?
which seems logical, internal systems and all.
Right.
But it also seems to have really close ties to some other critical areas in medicine.
Oh, absolutely. Pulmonology is very strongly connected to intensive care medicine.
Right.
Often, pulmonologists are the main doctors managing patients on life support, on mechanical ventilation, when breathing is severely compromised.
Wow, so really critical situations.
Exactly. They're often key in making those big decisions about life support.
Yeah.
And you also see a really tight collaboration between pulmonology and cardiothoracic surgery. And cardiology, too.
Because the heart and lungs work so closely together.
Precisely. They're so interconnected. What affects one often impacts the other. It's unavoidable, really.
That interconnectedness really hits home when you look at the history. I was quite struck by that old theory from Galen, a blood passing directly between heart ventricles.
Yeah.
Seems wild now.
It does, doesn't it? It seems almost primitive by today's standards. But it really shows how far we've come. What's amazing, though, is way back, 13th century. Ibn al-Nafis actually theorized pulmonary circulation pretty accurately.
Really? That early?
Yeah. The whole idea of blood going from the heart to the lungs, getting oxygen back to the heart, then out to the body.
That's
It
incredible.
was a huge step forward, even if it took centuries for it to become widely accepted.
Still, even with that early insight, pulmonology itself as a distinct specialty, it only really emerged in the 1950s. That feels surprisingly late.
It does seem a bit late, considering how vital breathing is.
Yeah.
But the groundwork was laid earlier.
Okay.
You had the American Thoracic Society's sort of parent organization, the National Association for the Study and Prevention of Tuberculosis, founded much earlier by big names like William Welch, William Osler.
Ah, so TB was a big driver.
A huge driver.
Yeah.
Focusing on one major respiratory killer kind of paved the way for studying other lung issues. It shows how public health crises can shape medicine.
Right.
And then as science advanced, especially understanding the link between breathing and measuring arterial blood gases.
That's the oxygen and CO2 levels in the blood.
Exactly. That was crucial. It helped the field really come together, attract more dedicated people. There was also this discipline called physiology, specifically focused on TB of the lung.
Interesting. So pulmonologists are the respiratory experts, but they don't work alone. We mentioned surgery, critical care. What other fields are closely involved?
Yeah, collaboration is key. The sources really stress that. Cardiothoracic surgeons, or just thoracic surgeons, they usually handle the major surgeries on the respiratory tract.
But pulmonologists do some procedures too.
Yes, they do. More minor ones, often minimally invasive stuff. And like we said, the critical care link is so strong that many pulmonologists in the U.S. get board certified in both pulmonary and critical care.
Okay, that makes sense.
And then there's this growing subspecialty, interventional pulmonology.
What's that involve?
It uses advanced techniques like bronchoscopy, sticking a thin tube with a camera down the airways,
Right.
and pleuroscopy, which looks at the outside lining of the lungs. They use these for both diagnosis and treatment. It's becoming a really distinct, important area.
It sounds a bit like detective work, figuring out lung problems. What are the key things they look for in the diagnostic process?
Well, it always starts with a really thorough history, looking for any family history of lung diseases like cystic fibrosis or alpha-1 antitrypsin deficiency.
Hereditary stuff.
Exactly. Then exposure is huge. Have they been exposed to toxicants? Tobacco smoke, obviously, but also asbestos, fumes at work. Even e-cigarette aerosol is on the list now.
Right, that's important.
Also, exposure to infectious agents and any underlying autoimmune issues that might cause problems like pulmonary fibrosis or pulmonary hypertension.
So it's way more than just listening with a stethoscope.
Oh, much more. The physical exam is still fundamental, of course. Inspection, looking for cyanosis, that bluish skin.
Low oxygen.
Right, or clubbing of the fingers, watching the chest wall, respiratory rate, then palpation feeling for lymph nodes, checking the trachea, chest movement.
Okay.
Percussion, tapping the chest, listening for dullness or that hyper-resonant sound.
Ow.
And yeah, auscultation, the stethoscope part, listening for breath sounds, crackles, wheezes, rales, ronchi are the technical terms.
Got it.
And because of that heart-lung connection we talked about, a good cardiac checkup is often part of it too. Heart issues can sometimes look like lung issues.
Okay, so they've gathered all this info. What are the common culprits they're hunting for? The actual diseases?
The sources kind of group them. First, you have your obstructive lung diseases. Airways get narrowed or blocked, hard to exhale fully.
Like asthma?
Exactly. Asthma, COPD, which covers chronic bronchitis and emphysema and bronchiectasis. That's one group.
Okay.
Then you have restrictive lung diseases. Here, the lungs can't expand fully. They lose compliance, get stiffer.
What causes that?
Could be issues inside the lung tissue, like pulmonary fibrosis, or external things affecting the chest. Infant respiratory distress syndrome is another example here.
And then you've got things that actively attack the lungs, right? Infections.
Precisely. Infections are a huge category. Pneumonia, bacterial, viral, fungal, TB, flu, COVID-19, RSV.
Respiratory syncytial virus.
Right. Tumors are another big one. Malignant ones like lung cancer, mesothelioma, benign ones like pulmonary hamartoma.
And cancer spreading to the lungs?
Very common, unfortunately.
Yeah.
Metastases from elsewhere often end up in the lungs. Then there are diseases of the pleural cavity that space around the lungs, like pleural effusion or pneumothorax.
A collapsed lung.
Yep. And finally, pulmonary vascular diseases, problems with the lungs' blood vessels. Think pulmonary embolism, pulmonary arterial hypertension, pulmonary edema.
And then there's a whole separate list for newborns.
Yes, specific neonatal diseases like infant respiratory distress syndrome, bronchopulmonary dysplasia, stuff unique to that very early stage of life.
Wow, that's a lot of ground to cover. So once they suspect something, what tools confirm the diagnosis?
They've got a whole arsenal, really. Clinically, lots of blood tests, especially those arterial blood gases we mentioned, checking O2 and CO2.
It's crucial.
Spirometry, full pulmonary function, tests PFTs to measure airflow, lung capacity. Bronchoscopy lets them look inside and take samples.
Like biopsies.
Yep, biopsies, brushings, or lavage, washing out a small area to collect cells and fluid.
Okay.
Imaging is key too. Chest x-rays, CT scans for more detail, sometimes more specialized scans like scintigraphy, PET scans, and polysomnography for sleep issues.
Sleep studies, right. And surgical procedures. You said pulmonologists do some.
Yeah, while the big open surgeries are for thoracic surgeons, pulmonologists do use those bronchoscopic tools for tissue sampling inside the chest. They also use various radiographic techniques to look at blood vessels in the lungs and heart, helps diagnose vascular problems.
Okay, diagnosis done. What about treatment? How do they tackle these conditions?
It's really varied. Depends entirely on the disease. Meds are often key inhalers for asthma, COPD.
Steroids, bronchodilators.
Right. Oral meds, too, like antibiotics for infections, maybe steroids. Oxygen therapy is common for severe conditions, just to keep levels up.
Makes sense.
When things get really bad, mechanical ventilation can be life-saving. And then there's pulmonary rehabilitation.
What does that involve?
It's quite comprehensive. Exercise training, education on managing the disease, emotional support, strategies for daily living. Usually involves a whole team, doctors, therapists, nurses.
You mentioned emotional support. Must be tough living with breathing problems long term.
Absolutely. And interestingly, the sources mention telerehabilitation.
Doing rehab remotely.
Yeah, delivering via technology.
Yeah.
Research suggests it can be pretty effective, comparable to in-person programs for chronic respiratory diseases.
Yeah.
Still developing, but promising for access.
And surgery.
Surgery has its place, definitely. For cancer, some severe infections, and in advanced cases, lung transplantation is an option.
Of course, prevention is always better. What's the advice there?
Number one, hands down, smoking cessation. Stop smoking or don't start. It's the single biggest thing for preventing COPD, lung cancer, so much else.
Can't stress that enough.
Nope. Also, vaccinations, flu, COVID, pneumococcal vaccines are really important. Air quality control, both indoors and out. and occupational safety, protecting workers from hazardous dust and fumes.
Makes sense. So who are these specialists, these pulmonologists? Where do they work?
They're highly trained doctors. In the U.S., it's med school, then a 3-year internal medicine residency, then another 2 or 3 years in a pulmonology fellowship.
Quite a path.
It is. And many do that extra year for critical care certification, too.
Oh.
Pediatric pulmonologists do a PEDS residency first, then specialize.
And you find them where?
All over, really. Hospitals, definitely, often in ICUs, outpatient clinics, specialized sleep centers for sleep apnea and stuff like that. They almost always work in teams, collaborating with other specialists. And many are involved in research, too, clinical or basic science, trying to understand the lungs better and find new treatments.
Sounds like they deal with a massive range of problems. What's the overall impact? How common are these respiratory diseases?
Incredibly common, and a huge cause of illness and death worldwide. Just in the U.S., something like 1 billion common colds a year.
1 billion, wow.
Yeah, and millions end up in the ER or hospitalized for respiratory issues each year. In the U.K., maybe 1 in 7 people has some kind of chronic lung disease.
That's significant.
It really is. And respiratory problems are a major reason people end up in the ICU needing ventilator support. It puts a huge strain on healthcare systems.
It really drives home how vital our lungs are and how much we rely on these specialists. So wrapping up this deep dive, what are the key takeaways?
I think the main thing is that pulmonology is this crucial evolving field dealing with our incredibly complex respiratory system. It covers such a wide range of conditions, from simple infections right up to chronic life-threatening diseases. Understanding the system, the history, the diagnostics, the treatments, it just highlights how important this specialty is for our health.
Absolutely. And it really makes you wonder, with all the challenges, pollution, new infections, smoking effects, how does our whole approach to lung health need to change?
Yeah, both for us as individuals and, as a society.
And what role could technology play in that evolution? Definitely food for thought. Thanks for taking this deep dive with us today.